Hey, everyone. Welcome to the Natural Cures Summit here. I am your host, Dr. Josh Axe, and so excited to have with us the expert on gluten sensitivity and overcoming food allergies today, Dr. Tom Obryan. I know Dr. Tom and I have gone to a lot of the same seminars together, really part of the same movement in terms of impacting and transforming the health of the country. And Dr. Tom is really really specializes in functional medicine and this new wave of physicians that don't treat the symptom, they treat the cause of your health problems. And there's one of the things that I love. I was actually looking through part of Tom's principles, and what I've come across is one of the things he does as he practices functional medicine is the first piece is first do no harm, which is something all doctors do when they take the Hippocratic Oath. He also makes sure that we're not just improving symptoms, we're improving overall function in quality of life in the body. Also, he looks at the root cause of healing the underlying disorders and also wants to improve the long-term health of the patient. Again, not just treating these temporary symptoms. So again, Dr. Tom is a true doctor of functional medicine. He's also the founder of the Gluten Summit, which to my knowledge is really the largest or one of the largest gluten-free summits in the world today. And he's been featured on pretty much every TV station you can imagine, from NBC to CBS to ABC. And he's also the leader in the movement of helping celiac gluten sensitivity and the founder of the Doctor.com. And so without further ado, Dr. Tom Obryan, hey, welcome to the Natural Cure Summit.
Oh, thank you, Dr. Josh. It's great to be with you. Thank you.
Well, I know one of the things we're doing in this summit, it's not just a summit like some of the others. It's really, we're trying to create a movement here. And you, of all people that we've had here and are having here on our summit/movement, is you are creating a movement and a wake here in the field of natural medicine. And not just natural medicine, just all over the place in general. This term gluten is referred to all over the place now. There are restaurants going gluten-free. There are, restaurants you'd never expect to. We see gluten-free labels all over our grocery stores. And so I know that you're going to talk to us about gluten sensitivity as well as how to overcome other issues, or what are some of the other things along with gluten that may cause issues. Maybe we'll talk about A1 casein and possibly even some of the other most common food allergies or intolerances that are out there today. But, the first thing I would really like for you to address is just giving everybody a basis. What exactly is gluten and why is gluten such a problem today?
Okay, good. Thank you. First off, gluten is not bad for you. Bad gluten is bad for you. And if we can differentiate, and our terminology has gotten a bit shortened, and it's similar to, this was 30 years ago, a company started producing this machine, and after a while, the actions of the machine became known as the company. And what I mean by that is they made a machine to make copies of things, and the company was called Xerox. And now we say, here, would you please Xerox this? And meaning, please make a copy of this. So the name of the company is now associated with the actions of one of the products they produced. The same is true with gluten in terms of using the word gluten, like using the word Xerox. We think gluten's bad for us. It's not bad for us. Bad gluten is bad for us. And what I mean, because there's gluten in many, many different grains. There's gluten in rice. There's gluten in corn. There's gluten in quinoa. There's gluten in most grains, but it's the toxic family of grains, wheat, rye, and barley. They're very, very similar, those three. And it's the proteins. Gluten is the name, the terminology for a family of proteins. It's an umbrella term for a family of proteins. And it's the children in the family, if you will, wheat, rye, and barley. Those are the ones that are a problem. Now, someone may be sensitive to corn. Someone may be sensitive to tomatoes. So corn protein may be a problem for someone, but it's a different mechanism than wheat, rye, and barley. And that's really the important thing to begin. understanding as we talk about this subject.
Well, Dr. Tom, I know there's so many popular books that kind of touch on this. I think that, from what I've read and when I've heard you speak, you've done the best job of really getting into the depth and explaining this gluten issue. There are books like Wheat Belly and books like Grain Brain that have brought some of this to surface, but I know that, again, you've been really leading this movement. One of the questions I would have is, some of us have also heard of things like einkorn wheat. What is the difference between regular wheat and einkorn wheat? Would you put einkorn wheat and the gluten there in that family of the wheat, rye, and barley that we use today in America?
Unfortunately, yes. They are in the family. Now, einkorn is one of the ancient grains that our ancestors a couple thousand years ago were eating. And since then, wheat has been hybridized. It's not been genetically modified, although that's coming very soon. GMO wheat is not on the shelves yet, supposedly, but hybridized wheat to have more gluten in it. It's called the 50-50 rule. In the last 50 years, the amount of gluten in grains, in wheat, has gone up by 50%. But what happens and the reason that einkorn, if someone has a gluten sensitivity, a documented gluten sensitivity, they cannot eat einkorn, they cannot eat sprouted wheat. We'll talk about wheatgrass if you like, wheatgrass juice. But the reason they can't, we have to go back to the immunology of what's happening here. So your immune system is the armed forces of your body. Then there's an Army, an Air Force, a Marines, a Coast Guard, a Navy, IGA, IGG, IGE, IGM. There are different branches of the armed forces within the body that's there to protect us. The immune system protects us. It's the armed forces. And the way that our body responds to foods is like the armed forces. Sometimes the Army gets called out, IGA. Sometimes the Navy gets called out, IGM. Sometimes the Marines are called out, IGG. That different branches of the armed forces may be called out. And maybe we'll get into this about testing in more detail. But Dr. Axe, if someone does a 90 food panel, IgG panel, looking at 90 different foods to see if you have a sensitivity, if it comes back positive, you got a problem. But if it comes back negative, it doesn't mean you don't have a problem with the food. It means you don't have an IgG problem with the food. You may have an IgA reaction. And this is renegade thinking to our allergists. But I think all of our consumers out there need to understand that there are different ways the immune system may respond. And you want to check as many of the ways as you can to confirm whether there's a problem or not. That's a little segue that's testing, but about sensitivity to the different types of grains.
Yeah, I mean it's a great point, Dr. Tom. This is what happens so often is that physicians will do this. I've had patients that have gone to another physician and they've come into me and they said, "Well, I went to my doctor and even though I've got this rash or this severe reaction, they did the test and so they said it's all in my head or there's really nothing wrong because their numbers or their test didn't show this." And it's absolutely ridiculous when I hear physicians say that. Obviously, the body is telling us something, and it's probably better than any form of medical test is listening to your body and seeing how it responds. Why do you think some people react to gluten more harshly than others? And I'd also like for you to touch on, okay, we've got this group of people called celiacs. What exactly is celiac disease? What is gluten sensitivity? And what is gluten tolerance? What are all of these? Because there's a lot of different terms throughout there in relation to gluten.
That's a really good question and a really important question to answer. Is it okay? I'd like to continue with about the different grains first.
Yeah, go ahead.
Answer that for you.
Yeah, sure.
So think about a vaccination. If we get a vaccination for measles, we get a shot of the bug. Measles, they actually give you a shot of the bug. And your brain says, whoa, what's this? This is not good for me. You, general, and Army, Air Force, Marine Corps generals sitting around the immune system with nothing to do. The brain says, you, general, you now are General Measles. Take care of this. General Measles builds an assembly line. The assembly line starts producing soldiers. They're called antibodies. And these soldiers are trained just to go after measles, nothing else. Go after measles. So the soldiers are going through the bloodstream everywhere looking for measles. And whenever they see a measles bug, they fire a chemical bullet called a cytokine, and they destroy the measles. General Measles is watching all of this. And when all of the measles bugs from the vaccination are gone, General Measles says, okay, turn off the assembly line. We don't need more soldiers right now. We don't need more antibodies. You and I should not have antibodies to measles in our bloodstream right now, unless we've been exposed, and then we should. But General Measles is vigilant the rest of his life, looking for measles. If measles ever comes back into the bloodstream, General Measles just has to flip the switch to turn the assembly line back on again. He doesn't have to build the assembly line. That's why if you go to Africa to visit, you need vaccinations months ahead of time for yellow fever and dengue fever and all these strange diseases. But if you go back 10 years later to visit again, you just need a booster shot 2 weeks before you go. You just have to wake up General Yellow Fever, and he starts making the antibodies again. That's what happens with foods. Now, General Measles is called a memory B cell. And memory B cells never forget. For the rest of your life, you are now vaccinated against measles and all the other vaccinations that we get. When you make elevated antibodies to gluten, we know that you've got a memory B cell to gluten. General gluten never forgets. And whenever the protein comes back into the bloodstream again, not in the intestines, but when it gets into the bloodstream, the memory B cells get activated, turn on the assembly line, make more antibodies to gluten. So when you ask about einkorn and the historic wheats or the sprouted wheat, the amino acid structures, now no one's ever done a test on this, no one's ever really looked deeply to see, but when you ask immunologists about the amino acid structure of the ancient wheats compared to the current wheats that we've been eating that General Gluten is making antibodies to, the amino acid structure of the ancient wheats is similar enough to the current structure that General Gluten recognizes it, and you make antibodies to gluten. It doesn't matter if it's the ancient wheat. That's what the immunologists tell us. So the way that you can tell as a consumer for you or your children is first you do the right test, the correct test to identify, do I have a problem currently with wheat? And if it comes back positive, yes, you do. And you completely clean up your diet with your doctor, your nutritionist. You learn how to do that. 6 months or a year later, you have the test again. Okay, the antibodies are down to normal range. They're not elevated anymore. Well, can I eat wheat? Can I eat einkorn? Well, I don't know. I don't think so. But because no one's ever studied that to see. But if you want to try, go ahead and try. I don't recommend it, but if you're going to try, here's how you do that. Go ahead and try. A month later, you do the blood test again. If the antibodies have come back, no matter theoretically or intellectually how smart it seems to eat the ancient wheat, your immune system is saying, you got a problem. And so you can't argue with the immune system. So if you learn the language to talk to the immune system by doing the right tests, let me say that differently, by doing the right tests, or if I say it this way, by doing the right tests, if you learn how to ask the question the right way, by doing the right test, you will be able to tell if you ever can eat that wheat or any form of it again.
Yeah, I know one of the things that I've done in the past, Dr. Tom, is had patients come in and we would run IgG tests and IgE tests out of the clinic. And I know with some people, and it wasn't always the case, a lot of times we would have them follow an elimination diet or more of even a GAPS diet, get off certain foods, and then we would go and do a test sometime later. And we would actually see for some of them, the intolerances would go down and go away, and certain other foods wouldn't. They would stay around. Has that been your clinical experience as well with not just wheat, but with some of the other food sensitivities?
Yes, some of them. Well, no one's ever done the test, as far as I know, in the studies I've read, no one's ever looked for memory B cells to dairy or to quinoa or bananas or tomatoes or anything else that you're sensitive to. But the immunologists tell us, well, of course you make memory B cells to it. Of course you do. That's what they tell us. But I've not seen any studies on that. The only ones that I've seen have been on gluten. No question, you have elevated antibodies. You've set up the mechanism now of protection, and you've got memory B cells for the rest of your life to gluten. No question about that. So in terms of others, I can't quote the science to you on that. I just don't know.
Sure.
I think theoretically, and what the immunologists tell us is, yes, of course you make memory B cells to anything that you have elevated antibodies to. I mean, that's the entire theory behind vaccinations and why people get why we give our children so many different vaccinations.
Well, moving into another topic here, which, by the way, that was it's a great point. I think for so many people that have ever had food intolerance testing done, the question they get is, well, when can I start eating this food again? I know it's a very common question that I've gotten over the years. And so,
Yes.
and I want to mention one other thing. I read a study recently, and I'd love to hear if you've read this study or if you have any thoughts about it, but to where there was a celiac population that they'd been eating healthy for a time. It looks like overall they had overcome most of the symptoms associated with celiacs, and they actually gave them a sourdough bread, and it looked like their body did much, much better with that versus other breads. Have you read a similar study, or are you aware of what sprouting may do, or a sourdough, a fermentation process, to the digestibility of gluten?
Yes. The theory behind that is that sourdough helps to break down the proteins a little bit more, and sprouting helps to break down the proteins a little bit more. The problems with that study, I have read that study, and there are 3 others like that. And one of them was in petri dishes or test tubes looking at immune responses. The problem with that study is that they don't check the antibody levels afterwards. They're determining whether it's okay or not by whether patients get symptoms back again, whether they get the bloating or whether they get the headaches or whatever their symptoms were initially. That they're not checking the immune system to see if general gluten is reactivated again. And so it's theoretical at this point. Once again, if you talk to the immunologist, they tell you, if you got memory B cells, anytime you get an exposure, if the peptides look similar enough, you're going to activate the immune response.
Good to know. Well, as you were going through that, you had mentioned symptoms like headaches and bloating. For people who are listening right now and they're maybe more new to gluten sensitivity, what are some of the warning signs if somebody is having a gluten sensitivity reaction? What are the most common side effects or symptoms that somebody might express?
That's a really good question. And to answer that question, we really want to take a big picture first. The New England Journal of Medicine tells us that celiac disease is one of the most common lifelong disorders in the world today. In the United States and Europe, not the world. That study said in the United States and Europe. And so I show that study and I say, so docs, if it's one of the most common lifelong disorders in the US, how often is it in your practice? And they sit there like deer in headlights. It's like it's an awakening moment. Oh my gosh, this must be in my practice a lot more often than I'm identifying it now. Because our doctors historically have considered celiac as a potential problem to look for if someone has gut problems, if they have diarrhea, and if they have bloating. That's the way the doctors were trained until about 5 years ago. The textbooks have changed now. New textbook came out from Johns Hopkins in December of 2012 that has a great chapter on celiac disease. So newer doctors are getting great, more current information, but most of our doctors think of gluten or celiac if you have abdominal complaints, bloating, gas, diarrhea. And those certainly are common, but the studies tell us for every 1 person that has GI complaints, there are 8 that don't. They've got joint problems or fatigue or brain fog or attention deficit or kidney infections or recurrent bladder infections or muscle pain or muscle fatigue or chronic fatigue. So the list of symptoms, there are over 300 different conditions that have been identified as potentially being caused by gluten sensitivity with or without celiac disease. So the way that you have to look at this as to what are the common symptoms, the way you have to look at this is anytime you are not happy with the current direction of your health, with the efforts you're putting out, you're trying hard, you've changed your diet, you're taking some vitamins, your doctor's given you some things to do to get rid of particular symptoms. Anytime your body's not functioning at the level you want it to, just consider gluten as a possible trigger and check. Just check. I've often been, I've heard it said often that I'm considered a fanatic, that everybody needs to get off gluten. I never say that. What I say is that if you're not happy with your health, everyone needs to be checked to see if they have a problem, because it's one of the most common lifelong problems in the country today. And what the clinical experience now is that somewhere between 3 to 6 out of every 10 people that come into your office, if you check them properly, have a problem with gluten. Somewhere between 30 and 60% of everyone that comes into the office will have elevated antibodies to gluten if you check properly. So that's not everyone out there in the world, but everyone that goes to a doctor with a complaint about their health. 30 to 60% of them, depending on what study you read.
Wow. I mean, it's incredible. I mean, there are so many more people struggling with gluten sensitivity than they realize. And this kind of brings me to my next question, Dr. Tom. I was reading an article, and I was actually really surprised by it, because I think that gluten sensitivity has been pretty much proven at this point. But there was an article I read, and it was written by somebody, I really don't believe them to be very reputable, but they said, "Is gluten sensitivity a fad?" What are your thoughts to an article like that? And I know I've seen one or two that have come out in recent months.
Oh, that's really a great question. And I love answering that one, Dr. Axe, because we really need to nail this one. We need to nail it. So let me give you the history on what happened with this one. There's a blogger in England who about 3 months ago wrote an article about, is gluten sensitivity a fad? And what he did was he quoted a study and that came out last year. And he said, see, here's the study. And the title of the study, I know this study really well. The title of the study was "No Effect of Gluten in Patients with Self-Reported Non-Celiac Gluten Sensitivity After Reduction of Fermentable Carbohydrates," the FODMAPs. So this blogger who never read the study, he just read the title to the study and read the first 10 words, "No effect of gluten in patients with self-reported non-celiac gluten sensitivity." So he writes, see, there's no effect of gluten. The proteins aren't a problem. And then he wrote about that. After that, Forbes published an article, "Gluten Intolerance May Not Exist." Then the Business Insider published an article, "The Science is In, Why Gluten Sensitivity is Probably Fake." And they were saying the science. And then Global News, "Is your gluten intolerance real? Study says gluten sensitivity is fake." And then the Huffington Post, and shame on the Huffington Post for this, "Gluten intolerance may be completely fake." And then the New York Times, "Is avoiding gluten a risky fad or a healthy diet?" All of these things have come out in the last month as a result of this blogger writing this thing a few months ago. Now, if you read the study, that's not what they were saying at all. What they were saying was that when you took the FODMAPs out of the diet, FODMAPs are carbohydrates that are fermentable that cause the gut problems, the bloating and the diarrhea and the constipation much more often than the proteins do. When you take the FODMAPs out of the diet, there didn't seem to be any effect to the proteins, taking the proteins out for abdominal complaints. But they weren't saying there's no effect to proteins, because what they even said in that study, they said that there was 37% of the patients had elevated antibodies to gluten. 37% of them, meaning that their immune system was saying, we got a problem with this protein. But the study wasn't saying there's no effects to the protein. The study was saying there's no effects to the symptoms of gut problems after you take the FODMAPs out. That FODMAPs, to get rid of gut problems, you take the FODMAPs out and it's comprehensive. But the study was read wrong. And so he started this thing, and the print industry loves sensationalism. They love to just come up with nonsense stuff that sells press. It sells more papers to be sold or more things to be read. I waited for this slam dunk study to come out, and it came out 6 weeks ago. And it was from a group in Italy. And what they did was they took 38 Italian centers certified by the government as centers for gluten-related disorders. And there were 27 gastroenterology centers, 5 internal medicine centers, 4 pediatric centers, 2 allergy centers. that the government said, okay, you guys are the experts about things related to gluten. And the title of the study is an Italian prospective multi-center survey on patients suspected of having non-celiac gluten sensitivity. So they looked to see, is this thing real or not? And what they came up with is, of course it's real. Of course it's real. And what are the symptoms that people get? And that's the question you asked me earlier. If you don't have celiac disease and you have a problem with gluten, but it doesn't manifest as celiac, and we'll differentiate that in a minute, what are the symptoms that people might get? So this was a study of 5,000 people who reported to the 38 centers. They think they have a problem with gluten, and the centers check them. This is what they report as the symptoms. 68% of them had a lack of well-being. They just don't feel good. 64% tired, 54% headaches, 39% anxiety, 38% foggy mind, brain fog, 32% numbness and tingling in their fingers and toes, 31% joint muscle pain. That means 1 out of 3 had muscle pain, 29% skin rash, 25% weight loss, 23% anemia, and then it's depression, dermatitis, rhinitis, asthma. All of these different conditions may be caused by a sensitivity to gluten without having celiac disease. It's a slam dunk. This study is 38 different centers certified by the government as being the specialty centers for celiac and gluten-related disorders. So now we have a slam dunk that says, obviously, some people have this problem. Not everyone, but some people do. And here's the symptoms that were most commonly reported.
Wow. I mean, it's just incredible. You know, it's so easy what shocks me, Dr. Tom, how often somebody will go write an article based off of a few sentences they read somewhere, and then how all of these other people will pick it up and start running with it. I was talking to a good friend of mine, Jordan Rubin, who wrote a book called The Maker's Diet, and he was talking about how that happens so often with other diets throughout the years. And the next thing I want to touch on, and I'd really love to hear you talk about, is its relation to autoimmune disease. I think that's one of the biggest things that we know that gluten can contribute to. And I was interviewing Dr. Alan Christensen, I know our mutual friend, about this and how it may be linked to even thyroid conditions like Hashimoto's. Talk about, and I think you've actually covered this pretty well, so it may not take you long, but what is the relation between gluten and autoimmune disease today, and how can gluten cause autoimmune disease?
That's a really important question. And that's where my emphasis is. My emphasis is not about having a problem with gluten. My emphasis is what happens to you when you have a problem with gluten. And the most basic way to explain it, and I have a lot of information on this on my website, and that was the purpose of my gluten summit, by the way, was for people to get an understanding about the autoimmune connection. So autoimmune diseases are the number 3 cause of getting sick and dying in the world. We know that. That's well established. Autoimmune disease means your immune system attacks yourself. It attacks your thyroid or your brain or your heart. It attacks yourself. It's an autoimmune condition. The problem with gluten sensitivity, the development of autoimmune conditions requires 3 things for almost all of the autoimmune diseases. One is a genetic vulnerability to that condition. That's the deck of cards you were dealt. That's the weak link in your chain. You pull at the chain, it breaks at the weakest link. It could be at one end, the middle, the other end. Where's the weak link in your constitution, in your body? That's determined by your genetics and how you've lived your life. So 1, genetics. Number 2, environmental trigger, the straw that broke the camel's back. And so you keep pulling at the chain, and the chain's eventually going to break wherever your weak link is. And the pull on the chain is the environmental triggers that we're exposed to. Environment means the air we breathe, the water we drink, the food we eat, the internal environment, the toxins we're producing. That's number 2. Number 3, intestinal permeability, or the slang term is the leaky gut. Those 3 things are associated with the development of autoimmune conditions like thyroid, as you mentioned, or lupus, or rheumatoid, or psoriasis, or MS, or Alzheimer's, or Parkinson's, which are autoimmune conditions. That it just depends on where your weak link is as to where it's going to manifest. So how does gluten relate to that? 2 ways. 1, gluten sensitivity is the most common environmental trigger that pulls on the chain. If you have a sensitivity to gluten, if you do, It's pulling on your chain every day, every time. You have toast for breakfast, sandwich for lunch, pasta for dinner, toast for breakfast, salad with croutons on it for lunch, and a cookie at dinner. That we have gluten multiple times a day, every day, pulling on the chain if you have this sensitivity. Now, how does it manifest? When you make the antibodies to gluten proteins, the proteins are many amino acids long. They can be 33 or 17 or 11, many different amino acids. If we consider a protein to be like a pearl necklace, hydrochloric acid undoes the clasp of the pearl necklace. Now you've got this long string of pearls tied together. That is amino acids making up a protein. Other digestive enzymes that we make are supposed to be the scissors that cut each pearl loose, cut each amino acid loose, and then we absorb them as single amino acids, or maybe as 2 amino acids together, no more than that. The problem with gluten is that we don't have the scissors to break it down, so it breaks down into clumps of pearls, 17 pearl clump, 33 pearl clump, 11 pearl clump, all these clumps that are toxic, and your immune system makes antibodies to that 33 pearl clump. And that's what you check for, is the antibodies to the clumps of pearls. And I'm going to say AABCD. Now it's 33 amino acids long in this example. I'm just going to say AABCD. So the antibodies are going through the bloodstream looking for AABCD, just like with measles, AABCD, just looking for it to fire a chemical bullet to destroy AABCD. Well, as the blood's going past your thyroid, the surface of the thyroid facing the bloodstream is made up of proteins and fats. The proteins are made up of long chains of amino acids, 100 amino acids long. So that 100-chain pearl necklace that makes up the surface of your thyroid, hundreds of amino acids long, includes AABCD. So you've got the antibodies looking for AABCD in the bloodstream, and all of a sudden it sees AABCD on the wall of the thyroid, it fires a chemical bullet to destroy what it's looking for, AABCD. But that happens to be a part of the bigger piece of protein that's the surface of the thyroid. But the gluten molecule attacks the surface of the thyroid. The gluten antibody, attacks the surface of the thyroid. Now you've got a damaged thyroid cell because it's been attacked by the gluten antibody. Your body is always cleaning up damaged cells, whether it's your brain, your myelin, your heart, your lungs, your kidney, your liver, your thyroid, your muscles, your bones. We've got a small number of antibodies to all of our tissue, and this is why there's a normal range of those antibodies. How come you've got antibodies to your thyroid? How come there's a normal range? Well, because your body is cleaning up the damaged thyroid cells and makes room for new thyroid cells to be built. So the body makes thyroid antibodies to get rid of the damaged thyroid cell that was caused by the gluten antibody mistakenly looking at AABCD. So your thyroid antibody gets rid of that. That was with toast for breakfast. Now you have a sandwich for lunch. More AABCD antibodies produced. They're going through the bloodstream. More attacks on the thyroid, because that's the weak link in the chain here. More thyroid cells damaged. More thyroid antibodies to get rid of the damaged thyroid cells. More gluten comes in, more gluten antibodies attacking more thyroid cells, more thyroid antibodies come in to get rid of the damaged thyroid cells, until eventually the thyroid antibody production mechanism has a life of its own. And now you're making lots of antibodies to your thyroid. That's an autoimmune mechanism. When you kill off enough of the thyroid, which is what happens when you've got elevated antibodies to any tissue, is you're killing off that tissue. When you kill off enough of the thyroid, you start getting symptoms of thyroid dysfunction. And if you've got a sharp doctor who looks for the antibodies and he sees you've got sky-high antibodies to thyroid, now you get a diagnosis of an autoimmune disease. So the autoimmune mechanism, after it kills off enough cells, becomes an autoimmune disease. Now, what do you do with all that? Well, the first thing is you stop throwing gasoline on the fire. If you have a sensitivity to gluten, you get gluten out of your diet, because that is triggering the production of all those antibodies to gluten that are, in this example, attacking your thyroid, because that's the weak link in your chain. It just as easily can be attacking the myelin in your brain, and that's what causes MS. Or it can be attacking your bones, and that's what causes osteoporosis. Any tissue in the body is vulnerable to AABCD attack from gluten antibodies. if that's the weak link in your chain, because AABCD is such a common sequence in the building of your proteins for your different tissues in the body.
Wow, that's incredible. I mean, that really is the best way I've ever heard it put. I think a lot of us realize if we've heard about gluten and autoimmune disease today that there's a link there, but that really is the best explanation I've heard on why it causes that. Let's talk about this, Dr. Tom. We all are at this point, we're realizing gluten's an issue. What are some of the other foods or culprits that are common in our diet that go along with gluten that may also cause food allergies? For instance, if you have a patient come in, Dr. Tom, and you sit down with them, you look at what they're eating on a daily basis, what are the top foods along with gluten that you recommend they eliminate? And then what does that diet look like?
Great question. So the first thing we do is we do a test to see, and we look at Army, Air Force, Marines, IgA, IgG, IgM, for gluten sensitivity. And then we look for 24 other foods. And what we commonly find is that with gluten sensitivity or without, these are the foods that are most common. And the top one on that list after gluten is dairy. Very, very common. After that, soy, eggs. And then the trickle-down effect where it's lower percentages are some of the more immune aggressive fruits like strawberries are fairly common. Cantaloupe is common, but it's really mostly the grains or the nightshade vegetables, which is potatoes, tomatoes, peppers, okra. The primary one that I find is grains. So our recommendation to patients is usually gluten-free, dairy-free, and any others that we find in our testing, but go gluten-free and dairy-free. Let's start there.
Now, Dr. Tom, let me ask you this about dairy and eggs. Have you heard or seen any of the studies? Now, I know that I've done certain forms of dairy over the years, but really, what's the difference between regular dairy and also A1 casein in cow's milk, A2 casein found in a human milk or goat milk? And then also, does fermentation, turning something into a kefir, make any difference? And then also, what about in the egg? Are egg yolks okay, or egg whites okay, or just neither of them?
Really good question. We'll go with the last one first. With the eggs, it's best to check egg whites, egg yolks, and many people who have an egg sensitivity, it's to the yolks, and they do not have a sensitivity to the white. There are some that are sensitive to the white and not the yolks, but if you differentiate out, then people may be able to have one component or the other in terms of eggs. So with dairy, the older cows and the, not old in age, but the older breeds of cows, there's a difference in the milk they produce. And when milk is not pasteurized and homogenized, that's different. But that's not really safe unless you have a certification agency who's overseeing all that. For example, here in California, they've had raw milk available for many, many years because it's tightly regulated. But going to raw milk in other places, we can't recommend that. For a single family on their farm, it's always a judgment call for them. But in terms of commercially, it's difficult to recommend raw milk. The protein structure of the A1 and the A2 milks, they're a little different. And some people will not react to the A1 milk, but they will react to the A2. Some will react to the A2, but not to the A1. The way that you can find out, because there's a whole group of folks out there that are saying it's okay to have, I believe they're saying the A2 milk.
Correct. And, like goat's milk and sheep's milk versus cows.
Right.
Yeah.
Right. Well, in the dairy industry, in cow's milk, there's a difference between A1 and A2. So I'd like to stay with that for a moment first.
Sure. Yep. Great.
And it really is a question of the immune system that we don't need to do an academic determination. You just ask your immune system. If you ask the right question, do I have a problem here? And it comes back, yes, you get it out of your diet for a while. You get the antibody load down. Say, well, can I have A2 milk? And the answer is, well, I don't know. But now we know that your immune system has a healthy response to protect you when it feels there's something you're drinking that's not good for you. So if you want A2 milk, go ahead and have some, have a little bit every day for a month, and we'll recheck again to see if the dairy antibodies come back. If they come back, it doesn't matter theoretically how much of a good idea it is to have A2 milk. Your immune system is saying for you, you got a problem. So you don't want to operate in this day and age. You don't want to operate with, well, I feel better if I have A2 milk. I don't get the bloating. For example, people say, I don't get the bloating if I eat sourdough bread compared to if I eat regular bread. It doesn't matter. Of course, it matters how you feel, but it's the immune response that triggers the autoimmune conditions that will manifest in 15 years as Parkinson's or in 20 years as MS. That's what matters. And so you do not want your immune system overly active fighting milk because you're drinking A2 milk and you aren't getting bloating. So you think it's okay because you aren't getting any bloating. But your immune system is working really hard to protect you, but it's pulling on the chain, and the weak link is your brain. And then here come the antibodies to your brain. So if I can give you that visual, you just want to check thoroughly. Now, in terms of goat's milk, cow's milk is 8 times the size of human breast milk protein, 8 times the size. That's why a cow has 2 stomachs, is to break down these larger molecules. That's one of the reasons why. And it's also to digest grass and get the CLA out of it and other things. But cow's milk protein is 8 times the size. It's a monster molecule in our bodies, which is one of the reasons why so many of us make antibodies to cow's milk. Goat's milk is 6 times the size of human breast milk. It's smaller, but it's still larger than human breast milk. And some studies were produced. It's called the homologs. What part of a protein molecule looks similar to what you're already sensitive to? And if you have greater than 68% similarity to human breast milk in a protein, your body probably won't react to it. And so in the milk category, the milks that have been shown to be safe for most people because they're over 68% similar to human breast milk are donkey, reindeer, and camel milk. Those are the only 3 that have been shown to likely not be a problem for humans. Goat's milk, unfortunately, for many people, not everyone, there'll be less than for cow's milk, but still it'll be many that will have an immune sensitivity to it. So it's donkey, reindeer, and camel. Those 3 milks have been shown to be safe for most people, most humans.
And I think one of the things you're saying, Dr. Tom, as well, is that, where, you could go and, as you're saying, have a severe reaction to gluten or a severe reaction to A1 casein. You can do another type of protein in a grain and another type of milk, let's say goat's milk, and maybe you're not going to have as severe of a reaction, but because it is similar and your body has recognized it, it's going to have a lesser reaction, but still you're going to have a reaction.
Well, it may have a lesser symptomatic reaction like bloating or abdominal pain, but it will have as strong a reaction to the weak link in your chain. Because when the memory B cell gets activated, it's not activated on a dimmer switch where it might be a little bit low and it just gets turned on. And when it gets turned on, the assembly line gets turned on to produce the antibodies. Now, the more molecules you're exposed to and the more frequently, then the dimmer switch ramps up, but it's not just a little dimmer at first. It kicks out enough to elevate your antibodies above the normal range.
Wow, good to know. Well, Dr. Tom, I want to say thanks so much. This has been a eye-opening interview, I think, for a lot of us, and you've really gone in depth on gluten sensitivity, some of the other sensitivities, and really the thing that I got most is really how it affects the immune system, because your immune system is so important for obviously your overall health, and also you look at the new diseases that we're seeing, these new diseases like lupus and psoriasis and Alzheimer's, and they are growing at exponential rates. And if we can go gluten-free as well as look at some of these other foods that we're sensitive to, it can help prevent something like Alzheimer's and that painful experience in the future, and help prevent a lot of autoimmune and chronic conditions in everybody. I want to encourage everybody to go to Dr. Tom's website. His website is thedoctor.com. And again, that's just the THE and then DR, so thedoctor.com. Also, he has got an amazing product on his website, and it's called the Gluten Summit. He had a summit that had over 100,000 attendees, and again, it's called the Gluten Summit. I really encourage you, check that out. There's also a website for that. It's theglutensummit.com. Really encourage you to check out that as well. And want to say, hey, Dr. Tom, thanks. This has been an awesome interview for everybody. And any sort of final words for those who are trying to overcome a gluten sensitivity, or just, or in general, trying to overcome any food sensitivity?
Yes, thank you. There's two things in your summary. It was a great summary, Dr. Axe, really great summary. And I would just comment that the message is not go gluten-free, but rather check to see if you need to. As long as you check and you do the right kind of test to check, and all that information is on my website, take the information to your doctor, your local doctor, and say, hey, please do this test, because the other tests are not accurate. But you want to test accurately. If it comes back negative, great, don't worry about it. You haven't crossed that threshold yet, but check it every few years, because no human can digest gluten. That's just well known. We don't have the scissors to break the pearls off. But in terms of allergies in general, just check. Just check thoroughly. Take a little time, listen to this one again, because we went through it kind of quickly, and talk to your doctor about the different branches of the armed forces, Army, Air Force, Marines, IGA, IGG, IGE, so that you check thoroughly to see if you or your children are having a problem. And when you check, if you have the problem, then it's a learning curve. There's no need to reinvent the wheel. There are many, many great sites out there. We have a lot of information on our website, thedr.com, about how do you begin, how do you implement a gluten-free lifestyle, how do you implement gluten-free, dairy-free. You can come to our website, or there are many other websites you can go to. So do not reinvent the wheel. Take your time, learn about this, get the big picture overview so that you can be successful at this. And it is going to be a little stressful, because we eat gluten every day. It's if you have the sensitivity. By the way, the foods that people are sensitive to, they're the foods that you like. That's why you like them, is because they stimulate you a little bit. They stimulate the immune system, and you get a little buzz from it. You feel better. Your metabolism goes up. Dr. Axe, you remember the Cocoa Pulse test? The Cocoa Pulse test was Dr. Cocoa. This was back in the 1970s, I think it was. He published a book, a medical doctor that published a book on take your pulse, see what your resting pulse is. Eat a food, take your pulse 5 minutes later. Did it go up? You got a problem. And what he was pointing out is that our metabolism kicks in to protect us. So we get this little feeling, we feel a little better. So in terms of food sensitivities, it's a learning curve. When you learn that you have a problem, you are not going to like it. Well, suck it up. If you want your body to function better, if you want to have well-being and longevity when you're in your 70s and 80s, be able to take your grandkids hiking in the Alps, or to go out dancing with your loved one at 75, or would you rather sit in a lazy boy and watch your favorite show, and just gain another roll around your center when you're 75? Or would you like to go out dancing 1 or 2 nights a week? Well, it's what you do in your 30s and 40s and 50s that determines how you function in your 60s and 70s and 80s. So you just need to check this sleeper condition that may not be making you sick, but is one of the most common lifelong disorders in the country. You just check. And if you find you have the problem, you start a learning curve to figure out how to transition. And you're not going to like it, but you get the right information, and you'll find it's not difficult. Lots of great information out there today. Our site, thedr.com, there's celiac.com, CELIAC, Dr. Axe's site, Sarah G's site, Green Med. What's their site, Dr. Axe?
Yeah, it's Green Med Info. And I couldn't agree with you more. And I just encourage everybody, check out Dr. Tom's site. Great information on there. And if you want to learn more about gluten, definitely check out his Gluten Summit, because his Gluten Summit is the best summit today on how to go gluten-free and why to go gluten-free and the long-term impact it can have on your health. Dr. Tom, I want to say thank you so much. This has been an incredible interview for everybody. We're going to you can check check out here some of Dr. Tom's links and potentially free gifts and things you can see here on the page as well. I want to say, hey, Dr. Tom, thanks again for just leading this movement and going gluten-free and for adding value today to our Natural Cures movement.
Well, Dr. X, thank you. And the last message that I would give, thanks for the opportunity to share this information. And I'd like to give you guys a quote. It comes from a really famous guy in Chicago. I spent 30 years in Chicago. This guy's name was Studs Terkel. And Studs passed a few years ago. He was a prolific writer and kind of guy with a cigar in his mouth most of the time, kind of a curmudgeon kind of a guy, but just brilliant guy. And he used to say to his friends as he was leaving, he'd say, take it easy, but take it. So with that, folks, learn about this, take it easy, but take it. Go for it. Go for your health. And thanks very much for the opportunity.
Awesome. Well, thanks, Dr. Tom. Thanks for everyone for listening, and excited about our next upcoming interview here as part of the Natural Cures movement. Thanks, guys.